Hello everyone, I am Shahan Layek. Welcome back to my channel, and we are in the middle of the 100 days 100 disease series where every day I discuss about a new disease. So today our topic is constrictive pericarditis. It is very important topic for NEET PG USMLE examination, and several times questions are asked in PLAB examination also. So let us learn about constrictive pericarditis. Constrictive pericarditis is actually caused by the inflammation of pericardium. You can understand from the name itself, pericarditis means inflammation of pericardium. Itis means inflammation, and pericarditis means inflammation of pericardium. So what happens to the pericardium after it becomes inflamed? After it becomes inflamed, it becomes thick. So the pericardium becomes gradually fibrosed, it becomes thick, and also it loses its elastic nature. So it becomes inelastic. So the pericardium, which has a natural property of elasticity, it loses its elasticity, it becomes thick, it becomes fibrosed, and it loses its property of elasticity. So this is constrictive pericarditis. And it acts as a rigid case. So it becomes so rigid that it encases the heart, and it pushes pressure on the heart. It creates pressure on the heart. So it acts as a rigid case. It acts as a rigid case. The elastic nature of the pericardium is lost. So you can understand it acts as a rigid case encasing the heart. This is very important in constrictive pericarditis. So basically what happens, it interferes with the diastolic relaxation. So it interferes with the diastolic relaxation of the heart. So the relaxation of the heart, diastolic relaxation of the heart do not occur properly, and the ventricular filling of the heart is also affected. As ventricular filling of the heart is affected, so cardiac output is decreased. So you have decreased cardiac output, and you have increased systemic venous pressure. So the systemic venous pressure is also increased. So these two things happens. So you can understand now the definition. Constrictive pericarditis is a condition in which inflammation of the pericardium occurs, and this results in developing inelasticity in the pericardium, and the pericardium becomes fibrosed, it becomes thickened, and it becomes very problematic. It becomes like a rigid case. So this will interfere with the diastolic function of the heart, and the diastolic relaxation of the heart do not occur properly, and the ventricular filling is affected, and this results in cardiac output decrease and systemic venous pressure increase. Now, why this is actually caused? This is actually caused due to tuberculosis. So tuberculosis is the commonest cause for this. This is very important. So it is caused mainly due to tuberculosis. Another cause is hemopericardium. Hemopericardium means the filling of the blood in the pericardium. Now this filling of the blood in the pericardium, this can be due to different drug intake, different kinds of drug intake. If you take thrombolytics and other drugs, it can cause hemopericardium. So most common cause is the tuberculosis, and another cause is hemopericardium. So it can also be caused due to a recent cardiac surgery. So if you have a cardiac surgery which is very recent, it can also cause constrictive pericarditis. Now you have other causes like SLE and rheumatoid arthritis. SLE can also cause this, and rheumatoid arthritis can also cause this. Now, what is the clinical features when we have this constrictive pericarditis? Basically, the patient comes with weakness. The patient comes in a very weak fashion, and the patient has fatigue. The patient has weight loss, anorexia. So all these are very important: weakness, fatigue, weight loss, and recurrent weight loss and anorexia. Next is protuberant abdomen. When you check the abdomen, it is protruded. Next is neck vein distended. So when you check the neck vein, it is distended. And you also have the Kussmaul sign. Now, Kussmaul sign may be positive. Generally, it is positive. So, Kussmaul sign is positive in constrictive pericarditis. Sometimes this is also a point to be asked in the examination. So Kussmaul sign positive, and also increase in JVP during the inspiration. Now this can cause increase in the jugular venous pressure, and the waveform of the jugular venous pressure is increased during the inspiration procedure. Next is it can also be presented with atrial fibrillation and muffled heart sound. Muffled heart sound can also be found out in these cases. Generally, the patient presents with ascites. Now, ascites is more common than peripheral edema. Peripheral edema is also there, but the more common feature is the ascites. Okay, ascites. The patient presents with ascites, which is more common. Next is investigation. How do we investigate the matter? For investigation purpose, we use two important things. One is the CXR, that is the chest X-ray. Another is the ECG. Chest X-ray, we generally find that the heart size is normal or it is reduced. So it can be either normal size heart, or it can be reduced heart size. That is, we can find in the CXR. Next is ECG. When you find the ECG, you can find low voltage QRX complex. Low voltage QRX complex. This can be found. And another thing which is also found in the ECG is non-specific T wave changes. Non-specific T wave changes. So these are the ECG changes which you can find: low voltage QRX and non-specific T wave changes. Along with, you can correlate with the CXR, that is the heart size is normal or reduced heart size. Now, as the pericardium has become stiff, it has become fibrosed, it has become thickened, it has become inelastic, so the heart size can be compromised. The heart size can become reduced. So by these two methods, CXR and ECG, you can find out the investigation. Next is the treatment. For treatment purpose, we generally do this one, that is known as pericardiectomy. This is very, very important. Pericardiectomy. What is the meaning of the term pericardiectomy? Pericardiectomy means the resection of pericardium. So you have to resect the pericardium. Resection of pericardium, and that is why it is known as pericardiectomy. Tomy means resection. Tomy means resection. So pericardiectomy means resection of the pericardium, and this is the only definitive treatment. So this is the only definitive treatment you can follow. This is pericardiectomy. Pericardiectomy. You can find out this. So this is the end of this video. If you like this video, make a thumbs up and subscribe our channel if you are new to the channel, and please go to our playlist. If you visit the playlist, you can find many videos on medicine. You can find many videos on pathology. You can watch all the disease videos. Must know diseases. There is a playlist known as must know diseases. You watch that playlist very carefully. Watch all the videos there, and you will have a great knowledge from this. And that will surely help you in cracking NEET PG and other examination. Thank you so much for watching this video. And if you like this video, please share this video with your friends. Thank you so much. Have a nice day. Bye bye.